All right, hey ho, let's go. Hello, my name is Dr. MarkAlain Dery. I am the Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana. I live in New Orleans, Louisiana, and I serve as co-chair for the ACOI Infectious Diseases Subspecialty Section. You've seen me do these updates now for almost a year in conjunction with the leadership of the ACOI. Hello, leaders at ACOI. And I have been hoping that these messages are helping you to keep up with the latest on COVID-19. I know many of you are in the thick of the fight. I'd like to thank all of you on behalf of all of us who focus daily on infectious diseases for a living, and certainly on behalf of the ACOI. Thank you, ACOI, for letting me do these videos. All right, so moving together with the ACOI, we will continue to share information as it becomes available and some of the hopeful progress that we are seeing. All right, now on to the stories. But before we get to the stories, I do want to acknowledge that the U.S. has hit a grim milestone with 500,000 individuals, Americans, our brothers, our sisters, our fathers, mothers, grandparents, children who've died. This tragic milestone comes 13 months since the first U.S. confirmed, since its first U.S. confirmed case of COVID-19. Interestingly, the death toll has only intensified in recent months. More than 138,000 people have died of COVID-19 in the U.S. since January 1st alone. So you've heard me say this before, mask up and COVID down. Sorry, COVID down. So let's get to the stories. All right, so let's talk about some of the CDC and FDA updates. Not surprising to hear, but the CDC is warning fitness centers to prevent outbreaks, to take measures to prevent outbreaks since the confines of indoor gyms is likely contributing to the fitness of COVID-19. A new study is tracing the virus to fitness centers, and no wonder. Think about fitness instructors yelling to their classes and the intensity of heavy breathing during workouts, and add to that lax mask wearing. Wear your mask. Mask up, COVID down. And this is a recipe for spreading virus, such as was discovered at a gym in Chicago where 55 coronavirus infections were found among 81 people who attended a high-intensity in-person fitness class between August 24th and September 1st of 2020. Now, 22 of those people had gone to the class on the first day of their illness or the day after. What? And this is super disheartening and irresponsible. 3 actually went to an exercise class on the day they received their positive test. Come on. In total, 43 gym members who tested positive participated in classes when they were possibly infectious. And the outbreak occurred even though classes at the gym were limited to 25% of their usual size, with only 10 to 15 people in attendance. Imagine if there weren't restrictions on class sizes. And it turns out members were required to wear a mask upon entering the gym, and their temperatures were taken as they walked in, but weren't required to wear a mask while exercising. I can assure you that it was not a doctor or an infectious disease doctor or public health practitioner that came up with that rule. Now, in Hawaii, 21 infections were linked to just one fitness instructor who taught at several local gyms. It turns out that just before his symptoms appeared, he taught an indoor cycling class with 10 participants, and you guessed it, no one was wearing a mask. Again, Whiskey Tango, Foxtrot. The result, all the class participants ended up testing positive for COVID. One ended up in the ICU. Now, there is an ordinance in Honolulu requiring all gym participants to wear masks throughout their workouts. Masks work, folks, so please, 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 I know that you know this because you're watching this video and you understand, but we recognize that masking is so incredibly important. So now on to the U.S. Food and Drug Administration, who this week came out and said that Johnson & Johnson COVID-19 vaccine has met the requirements for emergency use authorization, and probably by the time you actually are watching this video, there will be an EUA for this vaccine. This means that there's potentially a third vaccine for the US. This is wonderful news. This is a one-shot vaccine that doesn't need to be refrigerated or kept in sub-freezing temperatures like the other 2 mRNA vaccines. Of course, Johnson & Johnson is non-mRNA vaccine. Now, in the trials, it did show there was a 72% efficacy rate in the US. In South Africa and Brazil, it was lower. It was about 64 and 68% respectively. And that's largely due to the fact that the variants circulating in South Africa, which is the B1351, and the P1 in Brazil, very likely have evidence of deneutralizing the antibodies. Now, when you look at protection against severe forms of the disease, there was 86% efficacy in the US, 82% in South Africa, and nearly 88% in Brazil. So in terms of preventing severe disease and likely death, the vaccine did great and performed well, and that's what we want to see. So a January CDC study shows that most coronavirus cases are spread by people without symptoms. And given that it looks like there is some good news with the J&J vaccine, it seems that it may actually prevent COVID-19 infection without symptoms starting about 4 weeks. That is great news indeed. So this is a great scenario because if a vaccine prevented asymptomatic infection, it would also reduce transmission, not just keep the vaccinated from getting sick. So the clinical trial looked for asymptomatic infections among volunteers at several points and after they'd been vaccinated, and found that the vaccine had modest protection against asymptomatic infection from day 1 through day 29. And then after that, boom, it seemed to offer protection. And when the volunteers were checked for coronavirus antibodies at 71 days, after they'd gotten the vaccine, it seemed about 74% effective against asymptomatic infections. So this is super cool because it is like we have a buck stops here sort of outcome where we all know that those of us who have gotten the vaccine could catch COVID-19 and still pass it on. Of course, more studies are needed to verify this. And then this is really hot off the presses. Just in the last 24 hours, several studies did emerge out of the UK as well that showed that AstraZeneca and the Pfizer vaccine, so one of the mRNA vaccines, also appeared. So these are preprint studies. They just appeared online, and what they also show was that those vaccines not only prevent COVID-19, were very effective at preventing COVID-19, but they also prevented infection by SARS-CoV-2 virus. So in other words, you weren't carrying it in your nares or in your oral pharynx. In other words, it also prevented the SARS-CoV-2 virus, and then by extension or by logic means that the transmission, because if you're not wearing virus, we all wear virus because it makes us look fabulous, right? No, if you don't have virus in your nares and therefore you're not transmitting virus. Now, of course, the next obvious question is, well, if it was so good in preventing transmission, when can we take off masks? No, we don't go down that questioning sort of thing because we all need to be wearing masks for some time moving forward. We don't want just people who are vaccinated to be unmasked because that's going to send a bad message moving forward. Everybody should remain masked. Okay, so a new week, a new variant. This past week, we've seen a number of variants emerging in the U.S. Of course, we saw the 677 with variants in Louisiana. Hello, Louisiana, that's where I'm from. As well as New Mexico. We are going to be hearing from a new variant in California. There is a new variant in Nigeria as well, but New York City now has a new variant as well, and this is called the B1526. This is just like the government has a alphabet soup of acronyms, we are going to start seeing a virology or COVID-19 have a number soup of numbers, because all it is numbers, and it's even hard for me who looks at this stuff multiple hours a day to even remember all of these. But what we are seeing now is that in New York City, about 1/4 of all of the viral genomes in the samples that were collected do belong to the B526. And the thing that we need to consider is that this likely has an E484K mutation, which means that it can escape both natural and vaccine-induced immunization. and there is a potential for it to be more contagious as well. As I mentioned, there's a worrisome one in California as well, and as I mentioned, the one in Great Britain really is one that emerged from Nigeria, so we will continue to follow that. So now the question is, do variants reinfect people? I think the answer there is yes. In fact, I know two individuals myself that are in my own particular social network who both had COVID in the spring. One of them actually was required to get antibodies, so they actually had antibodies checked monthly for their job. That I'm not really sure why that was the case. They were actually working in St. Bart's in the Caribbean, and so for some reason that was the requirement there, is that antibodies needed to be checked regularly. So she had antibodies. Just recently came back to the U.S. Is in the extended New York City region, and has now tested positive for COVID a second time with PCR, and is also somewhat symptomatic as well. So now the real question here is, can the variants infect somebody who's already been vaccinated? And that is the real big question that we need to answer. So it is being acknowledged that the vaccines will need to be tweaked as the virus changes, but considering that everything that we know, those aren't huge worries compared to having a vaccine, because we do know the vaccines work, especially when it comes to these mRNA vaccines. We can tweak them very, very rapidly, as we've seen both Pfizer and Moderna do so with their mRNA vaccine. So moving forward, please continue to stay on the lookout for our regular updates, and to read more from the sources used in this report, please go to acoi.org/COVID-19, and together with the ACOI, we will help you have the latest information to help you respond to your patients and stay on top of the crisis. Please feel free to reach out to me anytime. I love hearing from you guys at madery@mac.com. Please stay safe. We can do this together.